My project is about exploring factors that are causing healthcare misinformation and specifically how healthcare professionals can deal with it. I wrote this paper for UWP 104F, and one of the prompts for the essay was talking about one of the pressing issues in healthcare. And after seeing all the misinformation that was spreading during the COVID-19 pandemic, and as someone that's interested in going into healthcare, this was kind of a topic that I had in mind. And one thing that I found was that people that engage with social media can kind of fall down the rabbit hole when it comes to exploring stuff that they're interested in. So that can kind of lead to them being pushed all these types of ideas on these social media systems, and then they're more likely to believe them. So healthcare misinformation is not just occurring from lack of fact-checking, it's also shaped by people's cognitive thinking patterns as well. When it comes to healthcare professionals, I found out that misinformation is kind of feeding into burnout, especially this was seen from the COVID-19 pandemic, and it's also fueling this type of lack of engagement with public health systems altogether. And when it comes to healthcare providers, I feel like they have a responsibility to obviously help as many people as possible. And one of the things that I found in my research was that healthcare professionals should deal with people engaging in misinformation in a type of compassionate lens. The idea isn't to shame the patient, but also kind of provide them evidence-based resources and kind of supplement the stuff that they find online. So it's more of well, if you don't want to be vaccinated, why don't we explore some other options instead of trying to say you should be vaccinated. During UWP 104F, Ruth Gustafson, one of the Shield's librarians, stopped by, and she kind of helped me better understand how to tailor my research when it came to using the UC Davis Library search engine. And then when it came to dealing with healthcare professionals, Melissa was able to help me out. So I was able to figure out better search terms that I could use in the UC Davis Library search engine, stuff like public health, propagation, social media networks, stuff that I wasn't really thinking of ahead of time. So I couldn't have done this, especially without the help of the librarians. Ruth and Melissa were both very kind enough to help explain to me how to use the UC Davis Library databases and how to integrate that research into my paper.